Hi everybody, I'm Dr. Jordan Williams. Today's 3-minute injury report is about the rotator cuff. What is it, how you injure it, and how you can get it fixed. The rotator cuff. All right, let's start with the anatomy today. So the rotator cuff is a series of muscles within the shoulder. So if we take a look at the collarbone and the sternum, or the breastbone in the center, and then we have the shoulder blade and the arm bone that comes down here, those muscles actually move the arm in and out, up and down to rotate here. These muscles all in here make up the rotator cuff coming down. When somebody says that they've hurt their rotator cuff or they've torn their rotator cuff, most of the time it has to do with this muscle at the top, called the supraspinatus. Don't worry about it, you'll never have to remember that word ever again, but if you want to impress your buddies at the cocktail party, tell them you hurt your supraspinatus. So when we talk about the rotator cuff, this muscle is usually what's strained or irritated. That muscle does this motion, and it does a little bit of this motion as well. So the good news is, many times when you strain your rotator cuff from high-fiving your buddies too much, this can actually be helped a whole lot with some exercise. The research bears out that exercise is actually much better in the early series of irritations in there in order to help with some of that pain as well. So the exercises that we'll have you do today are super simple, super straightforward exercises. The first one, what you want to do is start with your hand here, and you're actually going to push that hand into the other one. You're resisting it, and you're trying to get those muscles in here really firing up. You should feel it a little bit tight in the front when you do that. You're going to resist it and hold for about 5 seconds and then relax. Resist and hold for about 5 seconds and then relax. Then you're going to do the opposite. Wrap that hand around to the other side and you're going to push out. Resist, hold about 5 seconds and then relax. Repeat each of those about 10 times. When you're doing that, you should push into a little bit of discomfort is okay. We don't like super sharp pain, so push into a little bit of discomfort to get that muscle working. The last one that you're going to do, same thing, push into some discomfort but not so much into pain, is push into your hand, almost like you're punching into something. You can punch into a wall, push into it, but when you're pushing in there, make sure you're getting those muscles nice and tight. Those 3 exercises are some of the main and basic exercises that you can do to help get your rotator cuff back to 100%. Once you advance beyond those, you can definitely add resistance in different ways, and that's where we can definitely help you. If you do some of these exercises and you still have questions, or they're not working, or you'd love to be able to get some more guidance on that, we'd love to be able to help you out. And if you do them and they're absolutely helping and you don't have any more pain, definitely let us know. We'd love to see you either way. We'll talk to you soon.